Good evening. My name is Frank Jesse Robo, DMP student at Brandman University. This week's topic is the use of mobile app to reduce 30-day readmission of other adults with heart failure in skilled facility. Um, this is a global issue, and the use of mobile app is an innovative idea. And the question is, what problem will this innovation solve? First is going to address knowledge deficit related to signs and symptoms of heart failure. It's going to address the issue of frequent hospital readmission. It is going to address the issue of knowledge deficit related to severity of illness, both for the patients and the caregivers. It's going to address the issue of not adherence to medication regimen. Is going to address the issue of poor communication between the patient and the providers. And above all, it's going to address the issue of poor lifestyle modifications. So what do we know about heart failure? Globally, it is estimated that 15 million persons suffer from heart failure. In United States, it is estimated that 5.1 million people live with heart failures, with estimated 550 individuals will be diagnosed each year. Of these numbers, 2.8 million individuals visit emergency room, hospitals, outpatient clinic, physician office every year, and 1 million of them are admitted. And this is costing Medicaid and Medicare about $39.2 billion every year. That translates to $110,000 per individual. Worse off, according to some statistics, 20% of all the people that were discharged to nursing home between the year 2012-2016, 20% were readmitted within 30 days. 6.7% were readmitted within 7 days. And 11.3% were readmitted within 15 days. And 34.1% were readmitted within 90 days. And the rate at which this frequent revolving door is affecting patients' quality of life. Effort has been made to teach patients how to take care of themselves through printed materials, patient teaching. Various means have been adopted. However, in 2010, under President Obama, the Affordable Health Care was signed into law, and that gave birth to traditional care model. That bill does incentivize hospitals for hospitals whose patients that they discharge and do not return in 30 days had a higher payment rate. And for the hospitals who had their patient return within 30 days, were not getting reimbursed. The traditional care strategy was to have a specialized cardiologist, a specialized nurse practitioner, a social worker, a case manager, and a registered nurse, all forming a team and make the patient a center care approach. The approach was that on the day of admission, they actually have a meeting with the patients and discuss what the patient wants and how they want to be treated. They teach the patients and family members the trajectory of the disease process. They follow the patient through the admission stay. Upon discharge, the nurse practitioner will follow these patients to the nursing home or to their homes after the third day. They set up a predetermined time to make phone calls where they will monitor and check on these patients. Every evidence studies that was done shows there was marked improvement. The rate of the revolving door was mitigated. However, this is not sustainable because it's expensive to pay a cardiologist and advanced nurse practitioner to visit these patients in the nursing home or at their homes. So that led us to the issue of technology. In an attempt to explore what can be done in this digital age, I visited nursing home that I have worked in the past. I had a conversation with the frontline staff who actually care for these patients. These are the GNAs, the nursing assistants, the LPNs, the registered nurses. I talked with the director of nursing, the admission director. I had the opportunity of meeting with the medical director. And above all, I was fortunate to talk to the information technology vendor who supplies the IT. In all our conversation, everybody was enthusiastic, happy, and looking forward to any means that can be used to assist these patients that are suffering. And at the same time, reduce the burden of nurses spending a lot of time with these patients. So in course of my research, I had the opportunity to come across a well-tested mobile app called HeartMap. It's a non-invasive device that can be downloaded on any smartphone. It does not require internet to operate. This mobile device is designed in a text and audio delivery capacity. It contains 5 modules: the assessment, the vital signs monitoring, performing breathing and walking exercise, patient teaching. It provides the opportunity to enter a real-time data that will be plugged into a graph. The app is designed to have a conversational style of communication with the patient, whereby the patient may ask a question and a multiple choice answer will come up for the patients to pick. This mobile app enhances patient knowledge and engage patients in having to make an educated decision regard to their health. Above all, this mobile app is designed and places patient into zones: the red zones, the yellow zones, and the green zone. Based on the information that is entered into the system, if a patient is green zone, indicates stability. A yellow zone means gradual decline, and the red zone will indicate immediate attention to go to the hospital or to a provider. So at this junction, what would this innovative idea solve? It's going to give opportunity for a real-time monitoring of patient vital signs, doing deep breathing and exercises. It's going to improve the caregiver education on management strategies. It's going to reduce the cost of frequent hospital admission. It's going to enhance a smooth transition from acute care to a skilled nursing facility. This mobile app is going to engage patients on a self-care management that they are lacking. It is going to give the patient some sense of control over their health. It is going to improve their medication management or adherence, thereby reducing the nursing staff burden. Above all, it's going to improve the facility revenue, because when patients are stable and in their homes, not in the hospital, that leads to revenue for the facility. The app is also designed to remind patients every morning to monitor their weight, check their blood pressure, and answer some random questions regarding symptoms. These are, if information are input appropriately, this assists the provider to see the trajectory, to see the progress of this patient, and if adjustment need to be made. So this app is a game changer because it is designed that even a dummy can operate it. So it's a matter of just pressing. And since every adult, children, will have access to mobile smartphone, so this is a game changer to manage congestive heart failure. Thank you. Any questions?